Alrighty, let's get started. I'd like to welcome everyone to our third session of the Nevada Juvenile Justice Institute, and today we're going to be talking about screening and assessment, and particularly the YLS, which we use here in Nevada, as well as mental health screening tools that we use here. I am really excited that we are talking about this because this is new to our state. We have only recently added screening and assessment statewide. And I think as judges and judicial officers, it's really important that you all understand the information that we get from screening and assessment and what probation is doing with that information and what you kind of need to know about it. So that's what we're going to talk about today. As a reminder, this is part of our Nevada Juvenile Justice Institute, which means that this is the third of our 4 live sessions that we're doing. And then there will be recorded content available that you will take part in. And then once you've completed all of that material, you can request your certificate and your CLEs for this program. And so you have to do both parts for the certificate and the CLEs. But the second part will be all on your own time. So when you have your lunch hour, maybe in the evenings when you have a little bit of free time, and all of those sessions are designed to be pretty short, so they're 30 minutes to an hour, so it won't be too hard to get through all that content. So let's get started today. This is going to be interactive like all of our other live sessions have been, so please feel free to put any questions you have in chat as we go along. I would like our faculty to introduce themselves, and today we have with us Dr. Gina Vincent, who is a screening and assessment expert, and Pauline Sala, who is a Nevada juvenile justice expert. And so I'm going to ask them each to introduce themselves, and I'm going to ask you to start, Dr. Vincent.
Sure. Hi. Am I unmuted?
You are unmuted. You sound good.
Okay. Excellent. Excellent. So good afternoon, everybody. I'm Gina Vincent, and I am an associate professor in the Law and Psychiatry program at the University of Massachusetts Medical School, and I'm also the president of the National Youth Screening and Assessment Partners. And I'm pleased to be able to talk with folks in Nevada again.
And Pauline.
Hi, I'm Pauline Solon, the Director of Juvenile Services in Humboldt County, Nevada. Prior to my position here, I had the opportunity to be the Juvenile Justice Specialist for the state for 10 years, and I'm honored to be here.
And Pauline, you're a little bit quiet, so if you can turn up the volume on your phone maybe, or sit a little closer to it.
I may just have to pick it up.
Okay. Sometimes people's ways are the best ways. This presentation is designed to be a companion piece to a webinar that Dr. Vincent did for us here in the state just about a year ago. So if you haven't viewed that webinar, it is available on the Nevada Center for Juvenile Justice, so you can check that out. So today we really are going to just delve into specific questions that you might have about how this process works and about the information we're going to get from it. But first I want to start out asking all of you a question, just like I like to do, which is, why do we use screening and assessment instruments? Go ahead and write your answers into chat. To better understand the risk areas and needs of a juvenile, generally speaking. Yep, that's a good one. To achieve objectivity in assessing youth the best we can. Yeah, not having all of those subjective factors that come into play, absolutely. Objective information, yeah. Professional opinions and information. Yeah, the people who are doing, especially when we're thinking about assessments in the mental health arena, those folks have quite a lot of professional expertise. And so bringing those things into the forefront can be really, really helpful. So you guys seem to have a pretty good grasp of why we do this. I'm going to ask you, Gina, to talk a little bit more about that from an official standpoint.
So from an official standpoint, yeah, those are great responses. Obviously, you all are well aware of screening and assessment. So I'm just going to start by saying that it is the first point is that it depends on what screen or assessment you're using because they all have different purposes. They were all designed for a different purpose. Obviously, we're focusing largely on the YLS, and so the very first answer there makes very good sense to get a better understanding of use risks. Risk needs assessment like the YLS, the intention is to identify risk factors in a research-informed manner. So these are all items that we know based on a lot of research over a long time with a lot of youth are associated with who's going to continue getting in trouble and who's going to continue behaving in bad conduct. So it does help you key into those specific risk factors to make well-informed decisions that are backed by research. It's also a vehicle for improving objectivity, like you said, increasing consistency and equity. And one of the particular aspects of a risk needs assessment that I think is critical is identifying which risk factors are dynamic. So where do we have the ability to intervene with youth and possibly mitigate any further risk? That's really what these are for, is for driving that mitigation, not just knowing how high a risk level someone is, but how do we mitigate that? What are the things that seem to be really leading to their conduct that we want to change? When it comes to a mental health screening instrument, that's a little bit different. And when it comes to screening instruments in general, that's different. Those don't tell us or guide us about how to mitigate anything. They don't guide us around the proper course of treatment for anything like a YLS would. Instead, their intention is to help us conserve resources by screening out youth that are very, very unlikely to have whatever problem in question or whatever concern there is in question. They're unlikely to have it. So we weed them out. And then the kids who are left in, who are screened in, as we call it, we know that those are youth who might need some kind of attention, and that attention generally would be some kind of follow-up assessment so we can get more information, and that information will help guide us as to our treatment planning or what's the best case plan for this sort of youth. So a screen has a different purpose than an assessment, but I think that you guys have hit it right on the head with some of the answers that you gave. I'll pass it back to you, Jessica, unless Pauline wanted to add anything.
I think that one of the things that has become really clear through this process is that for screening and assessments, it really helps us identify the right youth at the right time to get the right service, right? And that's so critical in our system. And so that's the way when I see that question, that's the easiest way for me to understand it. Gina does a beautiful job of the highlights and the information on all of our instruments we're using, but it's the right youth, right time, right service.
Excellent.
That's a perfect way to describe it. And you know, when I kicked off our session on Monday on responding to adolescent behavior, one of the things I said is that we know from research that most juveniles are going to stop being criminals at some point, right? They desist in their criminality as they get older for a whole bunch of reasons. You know, they get girlfriends or boyfriends, they grow out of it, their brains develop, and all of those things. And so it seems to me like when we have kids that come in contact with the justice system, one of the things we really want is to actually help that desistance move along a little faster, and the best way to do that is to really try to match up to those risk factors and start to mitigate that. And so our key points here are all of the things that we've already talked about. It gives us a lot of consistency. And so without these tools, it's hard for folks like on the probation side to get the same kinds of results and outcomes every single time, which means that it's difficult to be able to measure data and look and say, are we being successful in our system? So this gives us that consistency to do that. It makes sure that we're focusing on those high-risk offenders and that everybody feels like the decisions are being made in a way that is equitable and objective.
Can I just add really quick?
Absolutely.
Can I add really quickly, Jessica, that as Pauline and Jessica explained, what they're explaining is the risk-need responsivity model, which we're going to talk about throughout this discussion. And one of the key considerations that I always say is when you're adopting a risk assessment, it is really not about the risk assessment. It's really about implementing risk-need responsivity. That's the whole intention of adopting a risk assessment tool, because it's what you do with that information, as they're both explaining, that's most important. It's not just knowing the use risk level, it's implementing risk-need responsivity, which is, like they said, the right youth, the right services, and the right time. You guys explained it very well.
All right, and so Pauline, I was hoping you could walk us through the process of how this is working in Nevada. I know that everyone in the state spent a lot of time kind of selecting the YLS and then putting systems in place for how and when screening and assessment occurs. So if you could tell us all about that.
Sure. Let me start with identifying our NRS statute that drives how we utilize the YLS in the assessment process. So it's first identified in NRS 62B.610, which really talks about the Juvenile Justice Oversight Commission and selecting a validated and reliable assessment for risk and need, and then a mental health screening tool also. And then NRS 62E.506 and 507 really clearly identifies how we utilize and we implement the YLS and our mental health tool into our juvenile probation departments and therefore into court processes. So I think it's really important to know that by statute that the YLS and the mental health tool is to be utilized and is mandatory for youth who are moving through the court system and going through, to the disposition hearing. It's really important that the assessments and the screening tools are conducted by then, and that the probation departments utilize that information to develop the recommendations for services and supervision. So yeah, Jessica's putting it up right now. There are some differences between our more populated areas and our rural jurisdictions. By law, we all do it for youth who are moving to a disposition hearing, but some of our smaller jurisdictions, Humboldt County included in that, utilizes the YLS for all of our youth that are coming in for a delinquent act, because it really helps us identify those we can divert out of our system, or those that we do need to move forward with an official petition. So if we go to, I think 62E506, Jessica, is where we can really take a look at the process.
There we go.
There we go. So this is our use of a validated risk assessment and validated mental health tool. And it does, this really does identify what the minimum standard throughout our state is. And then through the Juvenile Justice Oversight Commission, we were able to develop a statewide template, policy template for the jurisdictions and the state to use to really help us stay true to the fidelity of our tools that we're using. And Gina was, she was absolutely wonderful in helping us get that done, so that we're all really meeting the minimum standards, but we can also go over and beyond those standards depending on the jurisdiction and what's available in their community. So I'll just briefly talk about, at least in our jurisdiction, when we receive a referral We bring the families and the youth in. We meet with them. We explain our process to them, and that we do like to handle as many things as we can through a diversion or informally. They can agree to participate in the YLS before we do any kind of official court hearing. The youth has to agree, the families have to agree, and then if they do agree, we'll do the YLS. And 80% of our youth, actually closer to 86% of our youth, are actually dealt with informally in our jurisdiction. So, and we can only do that really because we moved to the YLS. It just helped us really make the best decisions for our kids. So larger jurisdictions, they're already going to court. The youth have pled, and we're moving to a disposition hearing, and then the family and the youth participate in the assessment process. And through that, the recommendations are developed. I'm not sure, Jessica, if that helps. I mean, I can go on forever and ever about the YLS.
Oh, I think that helps a lot, and I think this is a good time to stop and ask if there are any questions. And here I'm coming back onto the video. I got disconnected there.
I thought we lost you for a second.
I know. I thought we lost you too.
Yeah, I wasn't sure what we were going to do.
You would just talk. It would be fine.
Yeah.
And I have a hand raised, and I don't know if I can unmute your phone. If you want to talk out loud, if you could type your phone number into chat, Judge Mirans. And if you're only participating by computer, I won't be able to talk. Okay. 775-748. Are you participating by phone? I'm not seeing your phone number in my list. You might have to just type your question into chat. I appreciate that. I don't see your phone number in our chat list or in our phone list. Otherwise, we could just unmute you and it would be a little easier. While we're waiting for that, can you talk, Gina, a little bit about kind of what, why the YLS would have been selected over some of the other options?
Oh, sure. I'd be happy to. There's our question. Do we want to go to the question, or do you want me to answer?
Let's go to the question, and then you can maybe put that in.
Okay.
I do think, and this is Pauline, I do think we're gonna discuss that more in depth, especially because I know Judge Mirans is from a rural county also, bigger than ours. But we'll talk about service matrix and how we can tie those two things in, because that is a concern for jurisdictions that have limited services. But we're going to brainstorm about that, because I think that there's definitely ways that we can address that.
Yeah, I think it definitely is for you if you see a need that's identified and then you don't really know how to address it, what we should do. But that is one of the questions we'll cover. So let's have Gina go back and talk a little bit about why YLS was selected.
So I wasn't, I had the pleasure of being involved with the state and the initial implementation process and the procedural development and training and so on, but I wasn't involved in the initial decision-making around the YLS versus the other instruments that you all were contemplating. But I can tell you that I did help inform some of the people that were helping inform Nevada, and the YLS. So I don't know exactly why you all decided definitely the YLS, but I can give you the highlights, the high points. First of all, as far as risk needs assessment tools go for adolescents, it's been around the longest. It has the most research behind it. So there's been evidence that it works and that it predicts reoffending and that it's a reliable tool. And this evidence has been has come from the field, from probation officers using the instrument in many different jurisdictions, many different states and countries. So it is probably the most well-studied risk needs assessment, and having the evidence is critically important because you've then got, it's very unlikely that someone's going to come along and conduct a study that says that the YLS is not a good tool and starts questioning your practice. It's just highly unlikely because there's been so much. It's been shown to be reliable, meaning that to probation officers who complete the same YLS with the same youth are going to come to relatively the same answer. It also, another big one for me and why I recommend the YLS among my top instruments is that there is evidence that the YLS does not have racial bias. So there have been some studies on the YLS. There are several tools where we still don't have any studies, and there have been studies on the YLS indicating that it works equally well for white youth and black youth specifically. There's not been a lot of research yet with youth of color from other racial backgrounds, but we do have that. We definitely have the evidence with black and African American youth. So that's another big one because it's very important that whatever tool that we use, that there's some evidence that it's going to be equitable. And so it's really one of the best tools that you can have for this purpose.
And Jessica, this is Pauline, if I can just add that through the Oversight Commission, we had a subcommittee for the risk and need mandate that was coming through. And we did look at the OYAS, which is another risk and need assessment tool, and we looked at the YLS, and for all those reasons that Gina just presented, and that it's normed across different populations, different age, different populations, and Nevada is so vastly different throughout the state. That was really one of the important factors for us, that it was reliable, that it was validated, that it was already normed, so we knew that we could utilize it across our state. That the committee picked the YLS as the tool. We moved it forward to the full Oversight Commission and the advisory committee of the commission, and then it was voted in to be the statewide tool.
Wonderful. Yeah,
and then we met Gina.
I think it's the kind of thing where there's a lot of things to consider, and so figuring out what's most important to us in Nevada, I think, was really an important part of the process. So let's talk then about what information judicial officers should expect to get from our screening and assessment tools and when they should expect to get it. And Gina, I thought you were going to start talking to us about this. Yes,
happy to do so. So as I mentioned, and as Pauline and Jessica have also confirmed, of course, the hope around implementing a risk needs assessment is that you are following risk need responsivity. And that means like we said, the right kids for the right services at the right time. Therefore, in order for that to happen, judicial officers should get the kind of information from the YLS that enables them to know what is the right youth at the right time and the right services. And so we have worked with folks in Nevada to structure a template that I believe some of the probation offices are following, that actually structures the kind of information that should be shared in every single report that goes to judicial officers. And the goal here is to provide you with as much information as needed to help with those decisions. Obviously, the goal is for the probation officer to be very well trained and well versed in the kinds of services that they have and to be able to make very strong recommendations. But they're providing you with the kind of information that went into those recommendations. So there's a few key areas that I think are critically important for judicial officers to get. One is the strengths, and we try to start with the strengths of the youth to be strengths-based. So here are the areas where this youth is doing well. Here are the areas of the youth's life that is going to protect them from continuing to engage in bad behavior. The purpose of knowing those is just to try not to put any conditions in place that's going to infringe upon a strength. So say that the youth is very engaged in basketball. That's something that they strive for. It keeps them busy. They're not getting in trouble while they're playing basketball. It makes them feel better about themselves. They have good peers, good peer associations with the individuals that they're playing basketball with. That's a good thing, and that's going to help that kid do better in the future. So that's not something where we want to put a condition in place or a curfew condition that's going to not allow them to play basketball, or they can't be within a certain radius of a certain youth, and that means they're not going to play basketball. I'm sort of making up this scenario, but I think that we can see how the scenario could apply in many different areas where there may be restrictions put on this youth, and that takes away something that's actually keeping them out of trouble. So that's where strengths become important. The other critical piece of information is, of course, knowing what their priority criminogenic needs are. Those are the areas where, as I'm sure you guys are aware, those are the areas that that the YLS would suggest are most likely responsible for the youth's behavior, the youth's negative behavior. And there is reason to believe that if we put something in place that's going to address these needs, that behavior will change. So the priority need areas are very important. There should not be more than 3. And there sometimes is this philosophy that everyone should have 3. That's just not the case. The number of needs that a youth has is relative to their risk level. So there should not be more than 3 priority needs here. And if a youth is moderate risk, we may be talking about 1 or 2. So we're not looking for, there's a maximum, there's not a minimum. You should know what those priority need areas are and have a little bit of explanation about what's going on. So if substance abuse is a priority need area, what is the nature of that abuse? Are they stealing because they have a cocaine habit? Are they getting into fights because they're drinking a lot of alcohol and that causes their fights? So that's important information. Then the officers have been trained to make recommendations specific to those need areas to give you their best recommendation as to what services or supports or interventions they have available in their jurisdiction that should address that. And it's important, I think, for you all to be able to see that they've thought through, here's the need, okay, here's what we have that addresses it, and that these have been matched and linked. So this template shows you exactly how they've been matched and linked. So they're assuming that, I'm trying to think of an intervention that I know that Pauline has. They're assuming that the BITS or the EPICS model is going to help change youth attitudes. Okay, that's very likely. That's what they're there for. So you should see that linked. Lastly, you should also see their risk level, because the higher the risk, the more intensive interventions the youth needs. And the more we want to think about how do we mitigate their risk in some way other than putting them into a placement. And if a placement is the only option, sometimes it's the only option and that's where they go. But the higher the risk, the better the more important the mitigation plan in the community, the management plan in the community. There's also other issues that may come up that are important to address, and they should be conveyed to you as well. And that's if mental health is an issue, and if mental health is preventing the youth from benefiting from other kinds of services, it may be something that needs to be addressed, and that would be pointed out here. If learning disabilities are something that's preventing the youth from benefiting from other services, that should also be listed here. So those aren't priority criminogenic need areas, but we call them responsivity factors or barriers to the youth being able to fully achieve what we want them to achieve. And in the case management plan, you would want to have them addressed. I'll pass it to see if Pauline has anything to add.
I don't think so. There's different variations of this template that jurisdictions are using. So if it doesn't look specifically like this, but addresses all those components, then and you're capturing all the information that as judges you need, I think that's okay too. So some of them do look a little different. I know my judge is on here right now, Judge Carr, and she's probably like, that doesn't look like ours. So I just needed to say that. But I think they will vary throughout the state, but the information is still there. So
yeah.
and I just, one of the things that I think has been really important for us here is that when we do this in our, especially in our disposition reports, but even if we're handling things informally or supervision and consent, it really helps us stay out of the weeds with our kids and families, and keeps us focused on the priority areas, because I think that we all understand that when we're working with our families, it's easy to get into parenting issues, and they're not doing their chores, and all these things that I always say, like, get out of the weeds and get in the domains, because it does keep us focused to really address the important and critical pieces. And the other stuff, of course, you know, it'll work out if we're taking care of what the priorities are. That stuff happens less and less. And so I think this is a great way to allow judges to see, like, yeah, these are the critical pieces, and this is what we're going to focus on.
Can I go ahead, Jessica?
No, you please go ahead.
Okay. I want to piggyback on what Pauline has said, because I'm really glad that she raised that. First of all, I didn't mean to get anyone in trouble. Everyone has taken this template and individualized it and made it their own. So I want to be clear about that. As long as the information is there, that's what's important. But I think I can't stress enough what Pauline has said about the benefit of a YLS, directing attention where attention is needed, and trying to take the focus away from those things that are just irritating about a youth, or where they're continuing to get in trouble with their parents, but it's not like they're going out and committing some major criminal activity. They're getting in trouble with their parents, or they're still having some difficulty at school. That doesn't make them moderate or high risk for continuing offending. And so is that something that we really need to be paying attention to? I can't tell you how many times I've seen in narratives from probation officers before they are trained in risk assessment, that the things that they pay attention to are is the youth following their parents' rules, and are they going to school? And that's the main thing they pay attention to prior to having risk assessment training, and that's all that goes into the reports. And they recommend harsher dispositions if kids are not following their parents' rules and they are having issues at school. I'm not saying those things are not important, but there may be something else going on in the home that's causing that, and it doesn't have anything to do with the youth having conduct that we need to be worried about for public safety. So it's not necessarily leading to a public safety risk if the youth is not abiding by their parents' rules. I think that's the main point here, is to stay out of the weeds. I think Pauline said it very well.
And I've heard it kind of described as there are the sort of usually the big four driving factors behind a young person's criminal activity. And generally, things like school and families aren't part of those, and it's more like attitudes and beliefs, negative peer associations. Can you talk a little bit about what those things are?
Yeah, thank you, because I had that thought in my head and then I forgot to say it. So thank you, Jessica. Yes, so actually the big four is an idea that came from the adult world and adult research, and we don't know how well it generalizes to kids. So I don't talk about the big four with kids. I talk about the big three. Because we do know that three of them generalize very well to kids, and this has been replicated over a lot of studies, and they're exactly what Jessica said. It's personality behavior, so that's the areas, those are the areas where the way that it's measured in the YLS is aggression. Do they have a tendency for aggression? Do they have poor anger control? Is it, it's grandiosity? It's, I think the YLS puts lack of remorse in that bucket, but lack of remorse, lack of empathy, those are things we're very concerned about. It's basically behaviors that if they were an adult, we would say was antisocial. And when we start seeing those in youth, those are the ones we want to be most concerned about. Those are the ones that we know place youth at the highest likelihood to continue offending. The next one is attitudes and orientation. So if they embrace delinquent behavior and gang lifestyle or violence, if they embrace those things and they don't see anything wrong with it, that's putting them at higher risk for reoffending. And the peer associations is another big one. If they're hanging out with peers who are just engaging in that sort of behavior, that's the other big one, because we know that they learn more from their peers than from adults, or they model their peers more than they model adults at this age. So those are the three. Nowhere in there is it school and family. So thank you for making that point, Jessica.
Yeah, I think it can sometimes be hard because we're always sort of trying to think about like a root cause, and so trouble at school or trouble with your family can sometimes feel like those should be the things we address, or talking about their trauma. But those things don't necessarily change the delinquent behavior in the same way.
Right, and it sometimes takes the focus off of what the delinquent behavior really, it takes the focus off of what the root cause is, as you said. So occasionally there are interventions, there are family interventions that will help a youth adjust their behavior and attitudes. So they involve training the family how to be consistent with the youth. So sometimes that stuff can help with personality and behavior, but if the main problem is just in the home, there's probably something else going on in the home. It doesn't. So yeah, thanks, Jessica.
Thank you.
And I'll just add this, that I do think that it's important for the probation departments and the judges too, if we're at court. We spend a lot of time educating our parents on the YLS, just so that they understand it, right? And the importance of us focusing on those priority areas, because I mean they'll always try to get us like in the weeds, and if we're not on top of it, we're going to get there, and so it's really important from the very beginning to say, okay, this is a domain that they're high in. This is a priority. This is what we're going to provide to address these issues, but we need your help because it has to be consistent. And so educating the families on the process too is beneficial. I mean, we have some families that engagement level is low, but we still have to try to bring them in so that they understand the process too, and the importance of working on what's identified as the priorities.
All right, so let's move on and talk a little bit about some like history information that used to be sort of what we would use a lot of times to drive decision making around youth. And so the question I want to ask, and Pauline, I'm going to ask you to start here, is how is information like the age of the youth, their arrest record, the nature of their crime, and their family history incorporated into the YLS?
Thanks. Gina might need to come in on this one too.
That's great.
It's really interesting because Before we implemented the YLS, I can't tell you how many times I heard people say, like, oh, it's their first charge. It's their first charge. We're just going to admonish and close. Or they're really young. We're going to admonish and close. And so once we implemented the YLS, like, we really figured out the importance of looking at the entire picture, because we all know there's youth that have one charge, and it's a really violent charge, or there's victims in it, and that wouldn't be one that we just be like admonish and close. So the YLS it takes, the age, you're going to have all this information that you're going to gather through the YLS. Their arrest record is actually incorporated in the first domain. That one is, the first domain is really a static domain. So it's not dynamic, it's not fluid, it doesn't change as the youth ages, or that captures the information, the history, and it stays that way. It just doesn't go away. The other domains are really dynamic, right? And we'll talk about some reassessments and the requirements with the reassessments and if time passes. But when we're looking at the YLS, we look at the prior 12 months of the youth. So their arrest record, the nature of their crime is really going to be, if they get into an assault or a fight, it's going to be captured. If that's part of their pattern, it's going to be captured in some of the other domains. The family history, there's a whole family environment domain that we capture information on. We also capture information on that for like some responsivity factors throughout the YLS. So all of these are captured in the YLS. They may be in different areas, but we're going to capture that because although it's not, I wouldn't say that each one of those separately are a determining factor. Together, it gives us all a clearer picture of what's going on. And Gina can add to that if I missed anything.
I thought that was perfect, actually. I think the way that you introduced that was perfect from your perspective about it's a good reminder that looking at whether this is their first arrest or not tends to be the only thing many districts and jurisdictions look at, and there's this tension, often a bit of tension around first arrest, not a serious offense, yet this youth has a lot of risk factors. And so what do we do? Because we don't really have a leg to stand on because they haven't done anything really serious yet. So that can happen. Everyone gets arrested their first time, right? Like they all start somewhere. So just because this is their first arrest doesn't mean they don't need a good management plan or a good intervention plan to help prevent that from happening. Now that's going to be the rare case. But I think it's important to keep in mind that the number of offenses is not the most important thing. The other issue I just want to say is that number of offenses is the area where we're most likely to introduce racial bias, because arrest records and so on, it seems to be replicated in many places that they tend to have racial disparities when it comes to arrest records and so on. So the other risk factors are so much more important than that, and I think that that's why having a YLS is important, because it gets you away from just looking at those static factors. Family history doesn't factor into the YLS scoring at all. As Pauline mentioned, it's a little bit about responsivity. There's some responsivity questions around that, but it doesn't factor into the scoring at all. Yet we know families with a criminal history, that sort of hangs together with some of the other stuff that you are scoring within the YLS. Like, do they have consistent parental monitoring? Are they consistently disciplining the youth? Do they have a good relationship with the youth? You know, if they have a criminal history and that's still an ingrained part of their lifestyle, it sort of hangs together with some of those. But it's not part of the scoring. We lost Jessica again.
We did lose
Jessica. Jessica, are you still there? Do we
Let's see.
do we want to?
She's going to join right back on, but let me pull up the PowerPoint here. I just won't be able to share it until she gets back on.
I thought maybe we could skip the next question, or we can ask. We have a question. Do we want to take the question? The override?
Oh, yeah.
And talk about how the override works. Do you want to take
can.
that, or do you want me to?
Do you want to start, and then I'll follow up?
Sure. So the override, there's a lot of confusion about what override means in this context, and that's because the way that override is typically used in a probation office or in a justice setting is very different than what it means in the YLS. I shouldn't say very different, they're related, but the purpose of the override in the YLS is that there's good science behind the fact that having some allowance for professional discretion is important. And in fact, it's the fourth principle of the risk-need responsivity model is allowing some professional discretion. The reason for that is that there's sometimes some factors that are going on with the youth or in their life that are just not going to be captured in a risk needs assessment instrument. You can't possibly cover the entire universe of potential risk factors that could crop up in someone's life. And so for them, there may be other risk factors that you need to attend to or consider in your rating of the youth risk level. And so that's what this override option is here for. It's simply because some youth don't fit the mold. There might be something different going on in this particular case, and you don't want to ignore it. The YLS might be scoring this youth low risk, but the youth is telling you that they're going to go out and bomb their school, and you're taking it as a legitimate threat, not just, mouthing off, or they're telling you they're going to go kill the girl that cheated with their boyfriend, legitimate threat, and you're concerned about it. They may be low on the YLS, but you're not going to ignore that because it might be something that needs to be mitigated. And so this is where the override comes in. There should be very good documentation about the rationale for overriding a risk level, and then you may decide that youth needs to be bumped up. They're actually a moderate risk. That means that they have a moderate likelihood of reoffending, and you should put all the interventions in place that go along with that. That's what that means. It can work in the other direction too. You can have someone who's scoring moderate to high risk, and it's largely because of their offense history, and that doesn't ever go away in the YLS. But there's been a lot of change in their dynamic risk factors since, and so you feel like it's not an accurate reflection of their risk level, that they're actually doing better than that, and you bump them down. Or they have a lot of strengths, and so you bump them down. So that's the whole purpose, is that you don't think the risk level that is measured as it is scored in the YLS accurately captures the risk of this youth. That's what it means. And so you're going to adjust your interventions accordingly. Pauline, do you have anything to add to that?
The only thing I would add is that all of us throughout the state had built-in checks and balances with the override portion of the YLS, so that, like for our policy for Humboldt County, we have, we don't want more than 8% overriding data for our YLSs, because if you're having, I look at it that if you're having a lot of overrides, that may be a training issue that we need to address. That if you're having way more overrides than you should be, I look at it like, okay, are we missing something? Like, are we not capturing that information, the accurate information during the questions? There's always that small percentage that you're going to have with a professional override. And a perfect example is if a youth went out and committed a violent crime but is now in a wheelchair, that is now in a wheelchair, those are mitigating factors, like where it might not be, the highest level of supervision or a placement at a state correctional facility because there's other mitigating factors that are coming in. We've been doing the YLS for 3.5 years, I think, 3 years maybe, and we have done an override on 4 kids. So it's not, I think what happened in the beginning is we were still holding on to like, well, we know best. Probation knows best. We work with these kids the most. We know what's really going on. The YLS doesn't capture it. And again, some of that's getting in the weeds, and we have to pull out of that because the YLS does do a good job of capturing the information, but you're always going to have those. There's always going to be an exception to the rule, but it shouldn't be a consistent exception. It should be very rare, and the documentation and the probation department should be presenting the clear and concise evidence as to why that professional override is being used, because it keeps us on our toes too, and we need that also. But I think we get confused at using that professional override, and especially if we're really frustrated with a family and we're like, this is a county youth camp kid or this is a state kid, and the YLS isn't supporting that. The professional override could be used to escalate that youth in the system, and not that people are intentionally doing that. Those are the checks and balances that we need within the system to make sure that we're staying true to the fidelity of our policies, of the assessment, and doing what's right for the youth.
And so
Judge
Mirren,
go ahead.
I was going to say, Judge Mirren kind of talks about that this makes it much more subjective rather than objective, which is not what we want. And so as leaders, as our judicial leaders, one of the things that judges should be doing is having these conversations pretty regularly with the chief of probation and other stakeholders to say, how often is this happening? Are we seeing a consistency in why it's happening? And really tracking and looking at the data, and that's part of why using a tool is so great, is because it gives us that information that we can look back and we can say, we're doing a lot of overrides. Why is that happening?
And I think, Jessica, because this is one of the things that we struggled with here too, that sometimes when we implement a new tool, right, we thought that the professional override was really overriding the like maybe the recommended level of supervision, right? And the two are not connected at all. When you're using the professional override for the YLS, that's really you're overriding the risk to reoffend, not tying in, a supervision and consent to formal probation. They would be like, we have to override it because this kid needs formal probation. I'm like, no, you're not overriding the risk to reoffend. They either have services they need, or they failed at informal, or they failed at supervision and consent, but those two things were getting confused. And so we really had to focus just on training and education with that too.
Yeah, I was just going to, go ahead.
Go ahead. No, Gina, please.
I was just going to add that nationally, generally, when we see places putting in these kind of policies, and Pauline, thank you for reminding me that is the policy that was adopted by the state to be used in probation, that there be supervisor approval and good documentation. Rarely are you seeing a lot of overrides on the YLS. It's not a common occurrence, and that's generally the case. And because it's a good tool. If you're using a risk tool, some other risk tool in your state, like one of the detention screens or something that a lot of states have, if you guys are seeing a lot of overrides, that often is a key in that it's not a great instrument. So I think that if you're seeing something happening, some wildly overriding situation, it should be a key that maybe you need to take a look at your instruments. But the wireless is good and there shouldn't be a lot.
And Hearing Officer Dollinger also points out that that they can ask questions. They can say, why are we doing this professional override? So even at the point of dispo, so you don't have to wait until you're having that steering committee meeting or the meeting with the head of probation. You can ask questions right in the moment. That's a great point. And while I was enjoying my reboot of my system, I heard you say, Gina, that maybe we would just skip right over this next question. And so let's do that. And,
it was the question before this one to skip, right?
Yeah, so that's the one we want to talk about.
Yeah, because I think we covered it already. Okay, excellent, good.
Good. So then we've been talking around this question a little bit, which is this idea that sometimes we're going to have kids who have a high need for services like mental health or substance abuse treatment.
We lost you, Jessica. We lost your...
Can't hear my audio?
I can't hear you.
I can hear her. I can hear her.
Okay, so
I think
Gina
Pauline can't hear us. Pauline, can you hear us?
All right, so while Pauline's
Oh,
working
you can.
on her,
Okay, they're saying they can hear you. I can't hear you.
Yeah. Can you hear me, Pauline?
Oh, they can hear you. It's me.
So the question here is, what should happen to a youth who has a high need for services like mental health or substance abuse treatment, but a low risk of reoffending? So while we're getting Pauline reattached, let's have Gina start us off on an answer here.
Okay, this was Pauline's question, so I'm going to do my best. But she would probably say this one better than I would. Pauline, can you hear us yet? No. Okay. So first of all, I get a little bit confused about these questions because, and if I'm getting confused, I imagine lots of people are getting confused because we use the word need in a lot of different ways, and that's the first issue, I think. So when we're talking about risk, need, responsivity, we're talking about criminogenic needs, and those are needs, but they're risk factors, and so they increase the likelihood somebody's going to offend. And in that context, there's no such thing as a low-risk, high-need kid, because if they're high need and those needs are risk factors, they're not low risk. I hope that makes sense. So one problem is the word need gets used in different ways in different contexts. So I think we need to be careful about that. Substance abuse is a risk factor. So to find, and there are occasions where you'll have youth who are low risk because they don't have a lot of other risk factors, and substance abuse is the only thing they're presenting with. So maybe we want to refer to them as low risk, high need kids, but generally if a youth has a significant substance abuse problem that requires intervention from a justice agency, they've got other risk factors too, and they're going to be at least moderate risk. I don't see, and I'd be curious to hear what Pauline says on this, if she can hear anything that I'm saying, but I don't see a lot of low risk, high substance abuse need kids. So it happens, but generally you're talking about the youth who are smoking a lot of marijuana. They're not getting in trouble. The marijuana is not leading to delinquent behavior. It's not a risk factor for them. Maybe we're concerned because they shouldn't be smoking marijuana, so maybe they should be treated by a different system because it's not a risk factor. We're not concerned about public safety risk with this particular youth. Mental health is a different issue because mental health, we can call that a need, but it's not a risk factor. It's not a criminogenic need. And in fact, there's been a lot of studies with both youth and adults showing that if we put mental health services in place for kids and just address mental health issues, it doesn't change their risk. They continue offending. So Mental health, I think it's important to keep in mind that the youth we want to try and manage in the juvenile justice system typically would have mental health needs and risk factors, and so we're trying to address both. They've got dynamic risk factors, criminogenic needs, and mental health needs, and we need to address both. We don't want to just address mental health. If you truly have a youth, and these come up a lot, and I know that you get exposed to them, I know they end up in your system sometimes, you truly have a youth who's low risk, they don't have risk factors, we're not concerned about their risk to public safety, we're not terribly concerned that they're going to commit a lot more crime, but they have mental health needs, I'd be looking to try and serve that youth in a different way, like divert them and get them mental health needs or something of that nature. Because this system, if the goal is, if you're putting interventions in through this system in some formal way, that the youth has risk factors that need to be addressed, or they committed a serious offense, and you guys, it's incumbent on you guys to be having that youth in your care. Pauline, did you hear any of that?
I heard some of it, and I just want to add that I think in our rural jurisdictions, this is where the Juvenile Services Agency is really the point of entrance for these kids, right? Because and in the larger jurisdictions too, but when there's not other entities to address these issues, these are the kids that continually enter our detention centers for minor charges and even status offenses. I mean, urban areas don't really take status offenders in their detention center. Rural jurisdictions do, but they come through our door. And so I think what happens is that, yes, they're at low risk for reoffending, but the Juvenile Justice Agency is the conduit, becomes the conduit to get the services they need so they don't keep getting arrested and brought into our detention center on minor offenses. And so I think that we all just, need to be aware of that, because it does happen, and these are the kids that really we're seeing over and over in our detention center for minor offenses, but they're low risk. But they need other services that we can be the conduit for.
Like mental health?
Like mental health.
Yeah.
And so Judge Mirren brings up an interesting point. And Gina, you've talked a little bit about this, but maybe you can talk about it some more. He says, in this definition, does a high mental health need capture the kid with a significant trauma background, or is that in a different category?
Yeah, that's a really important question. So the answer is it depends. So generally, youth with a significant trauma background are going to have mental health needs. However, we need to keep in mind, my background is in psychology, and we need to keep in mind that not everyone who's been exposed to traumatic events actually ends up having a mental health reaction to that. All right, so when I'm saying significant trauma, I mean they're actually having trauma-related symptoms, that it has affected them. Maybe they have PTSD, maybe they have anxiety and of another nature now. Maybe they have substance abuse, and that's how they've been coping. So you all, I'm sure, know how many different ways people cope with trauma that's not necessarily healthy. But just because someone's been exposed to traumatic events does not mean they end up with significant mental health concerns. But certainly, if they have significant trauma, they ended up with mental health concerns, yes, they fit into this category. Now, trauma sometimes can be related to some other risk factors that would be measured in the YLS. Aggression. So individuals with a significant trauma history who have mental health related symptoms from that, as I'm sure you all know, may tend to react aggressively to any perceived threat, even when it's not a threat. And that makes them a higher risk. It doesn't make them high risk, it just makes them a higher risk. So there can be ramifications of having that trauma background that lead to them being a risk that require some kind of intervention, some kind of juvenile justice related intervention, like MST is a good one. Cognitive behavioral therapy is a good one. I think what's really important is when people have a significant trauma history, we're relying on our mental health professionals or our psychological evaluations, and hopefully you guys all have somebody who does good psychological evaluations. I would say we want to rely on those evaluations to tell us how much of a concern is this in terms of risk for public safety, and how much does it shape the services that we're going to provide. So that was an earful. It's a complicated issue. Which is the universal legal answer? Which thing that I said, because I said a lot. Oh, yeah. I figured anyone who has a law background would understand the it depends.
I do think that some of that, the significant trauma background can be captured if you have a skilled assessor with motivational interviewing. There's other factors that we do, take into consideration, and there's a section for that with the family's history, the parents' history, and then the youth's history. And it does ask like history of trauma, and with a skilled assessor, you can gather lots of information on past trauma for our kids. I think one of the things that we've really learned here through making some errors with that is that we really need to know if our youth have what their history with trauma is, because it does affect how we should be responsive to them, right? And how we go through our process. We should always be cognizant of that. But when you have youth who have significant trauma, our process is even, is re-traumatizing to them if we're not aware of that. So I do think the YLS captures that in different areas, but I do think that the more trained the assessor is, the more information that can be gathered about that.
And I would just add that you do get that, I agree, you get that background information. I don't know that it's always as apparent how the youth has responded to that trauma. So it may be, and sometimes a clinical evaluation is helpful, because the mere fact that they've got a history of being exposed to traumatic things doesn't mean that it's causing problems for them now. That's all. That's where sometimes it's helpful to get a clinical evaluation and to know the best course of treatment around that. And I couldn't agree with Pauline more that knowing that history helps with knowing how to work with that youth regardless. Did you just skip another question?
Oh. We did. So I think that's the thing that's the most important thing for judges to know about trauma, is that it's really important for us all to kind of understand trauma and understand what folks who are trauma reactive, what that might look like. But that's about how we sort of react and interact with the kids and families that come to court. And it's not so much about always needing to address the trauma. Like, we don't always have to send someone to trauma-focused CBT, because maybe they don't need that. But if we know that they have trauma, then we should be thoughtful about how we're reacting. And so I think that that's a really important message for the judges to get. And kind of along these same lines, we're going to talk just for a minute about reassessment, because I don't know that the process of reassessment always makes sense, or that we always know when to use it. So Pauline, do you want to talk a little bit about reassessment? When should it be done, and what should judges do for reassessment, look for in reassessment?
Sure. I'll speak to our statewide policy for reassessment. We all agreed that our minimum standard was 180 days, so 6 months, that we would be doing a reassessment. One of the things to consider with the reassessment is that it's not time-consuming. we've been working with these kids and these families. We've been collecting information all along. Our families are starting to open up and share information with us. So the reassessment, at least our experience has been, the reassessment is much less time. I don't even think the original assessment's that time consuming because we get so much wonderful information out of it that I don't think it can be time consuming and that at the same time. So it is a quicker process, though, I want to say. We do it at a minimum of 180 days. I will say there's jurisdictions that if the probation department's going back to court to increase a level of care, if we're looking for an out-of-community placement, and that's our recommendation, our judges want a reassessment done, and they want evidence as to why we would even be asking for that. So it does, again, the reassessment keeps us focused. Just like we revisit our case plans with our kids and our families frequently, we should be doing that with a reassessment when we're doing that to make sure that we're not in the weeds and just frustrated. So I think that the judges should be looking for, if we're asking for an out-of-community placement or a state commitment, that a reassessment should support that.
I'll just add one comment. I completely agree with Pauline, and I don't remember because it's been a while, but I thought that was part of the legislation too. So I'll just say that this has been generally one of the hardest things to get implemented, but nationally. But the idea is that a probation violation should inform the probation officer's recommended best response to the reassessment should inform the probation officer's recommended best response to a probation violation. It's really important because maybe there's something that was missed. Maybe there's just something that was missed that needs to be adjusted in terms of the case management plan. And they don't need something more serious like detention. I can't hear you. Can you hear Jessica?
I couldn't, and I thought it was me again. Now I can.
No, that is me. So Hearing Officer Dolinger says if a youth is placed on formal probation and then within a month or two violates and gets a new petition, do they need to be reassessed before disposition for the violation of probation?
Can I just address that? How we do it?
Yes.
What we do is if and my judges are so supportive, so I have to throw that out there because it does make a difference. But it really, if that's happening, we have to ask ourselves as the probation departments, like, okay, do they have enough time? We had them for a month. We did the YLS. We're getting the services attached to those domains, and have they had enough time with those services to really make some behavior changes, right? I mean, if the new charge is violent, I mean, there's some layers to that, but I think that the way we were all trained with the YLS is that if it's a technical violation, if there are two technical violations, I wouldn't have our office do a reassessment on that. I'd have the probation officers be like, let's look at the case plan and see what we missed, and do they need more time with those services. So if it's technical or probation violation, that's not we wouldn't do a reassessment with that. I think we have to make sure they're getting the services long enough to make some behavior changes. I can tell you that since we implemented the YLS, we have not arrested a youth on a probation violation. and I probably just jinxed my office, but it's really helped us get away from those, because a misdemeanor is not gonna bump up their risk level anyways, and maybe we're just missing tying in the services to the priorities. I probably did just jinx our office, and my judge is probably like, "Oh boy."
But I think it's the system. That's sort of how we want it to work, and so you would hope that would be a pretty rare occurrence that you would do that. Oh, good. And as far as
yes, I'm okay so far, so that's good.
And then for our final part of our conversation, that we wanted to talk more about that question that came up at the beginning, which is that how should judicial districts in the more rural parts of our state address the criminogenic risk and need factors when they don't have a lot of services? And so, Pauline, I know you guys have been able to develop quite a few services in Humboldt County, even though you're still pretty rural. And so can you talk a little bit about how the probation office and juvenile services sort of wears a lot of hats?
Sure. So we had this issue too. We didn't have very many services in our community. We do have a family support center in our community that handles the majority of the adults and the adolescents seeking substance use counseling. And then we have one mental health therapist there full-time right now for to see our kids. We also have rural mental health clinics. We had a couple private providers, but what we were finding out is that because working with our juvenile justice adolescents is a little different. It's a lot different than working with adults. And then you add adolescents versus adults, then you add juvenile justice in that. And you know, sometimes our kids don't like to really behave in groups in the beginning. And so they were getting kicked out of groups, and there was just things that were happening, which we understand. So one of the things we did when we implemented the YLS is that we developed a service matrix. And we actually separated it out per domain, and then low, moderate, high, very high risk. And so we brought together all our stakeholders. So the court was involved, our treatment providers that we had at that time were involved, the probation department was involved, and we said, okay, what services do we have available right now? And we would put those in our service matrix depending on for low-risk kids, moderate kids. And then what we did is we pulled the last 6 months of data from our YLS and just did some data analysis in our own agency about, okay, what domains are we missing? Like, what services are we missing that we can't get our kids right now? And so we did that, and we identified, and we did have some, there was several of our kids had the same top 3 domains. So as Gina said, those are the ones that do paint the path. And so then we started researching, like, okay, what's the most effective way to address this? And what does the research tell us about these type of behaviors and adolescent programming? So once we did that, we identified different groups, different programs, and then because we weren't detaining kids as much, we could use some of our savings in detention to retrain our staff to provide services on site. So we have between 15 and 20 hours a group on site a week, depending on the number of kids that we have available. We run 8 to 10 week sessions of them, and the groups that we have identified, and we have a menu of groups that we can pick from for that 10-week session. and we look at our kids that we have currently and what areas we're going to need to focus on. Those are the groups we provide. And the state also, through the Juvenile Justice Oversight Commission, identified that our programming for juvenile justice needs to be evidence-based. And so we had to get rid of some of the programs that were like, yeah, we've been doing this for 20 years and this is great. And we're like, no more, because it's not evidence-based. And we had to replace those with programs that were going to be effective for our kids. So my detention staff, my probation staff, they're cross-trained to do actual group counseling in different topics. They're certified in the curriculum. I have a probation officer who's certified with me for multidimensional family treatment, that we provide our most at-risk kids, our kids who are really on the verge of getting sent out of our community, participate in that program, which is an evidence-based. It's effective with our juvenile justice kids. It really works comprehensively with the family unit, because we want to make sure that we're trying to address those areas that we need to before we place them out of the community. So I know it sounds like it's easier said than done, but it really is possible, because our detention numbers went down. I had salary savings in there, or I had, we're not feeding as many kids in there. We're not replacing uniforms in there. And so we could take that money from there to train the staff and purchase the curriculum, and make sure our service matrix was really what our community needed. Now, we still work with our community agencies. We still have, our substance abuse providers. We still have our mental health providers. We work closely with them. But there's a criminogenic factor that we need to take into consideration when our kids need certain programming that the probation departments can do. Staff can be trained in it. Groups can be effective. It really has changed the way our youth view their probation officer, because they know they're still going to hold them accountable, but that they can really process things that are difficult to process in group with them. It's just increased the therapeutic alliance and with our kids and our staff here, and we can still hold them accountable while giving them the services that they need. So I always tell people, if you don't have it in your community, let's figure out a way to bring it, because you can bring it there. There's different ways we can do that, and most of my staff are trained as trainers in curriculums. I'm always willing to share them with other jurisdictions. I'm willing to share our service matrix. You can see any of that, but we can't wait for other community agencies to come into our community to give the services our kids and families need.
I love that. That's such a great call to arms, Pauline. And I think it's great that your staff has been really willing to take on some of these things. But a lot of those curriculums that are designed for probation youth have been designed to be used by probation officers, and so the training isn't too onerous, and you don't necessarily need to have a master's level for most of it. And so I think in most of our places, a lot of those things you really can add without needing to have an external provider. So I love that you guys have done a lot of that work. Gina, did you want to add anything to this conversation?
Not really, other than to say that Humboldt County, Pauline, are my model for other rural counties that might say they just don't have the services. That's where I connect them, is with Pauline. And I do just want to also mention that the particularly innovative states are moving in this direction with probation in general, where they're getting training on the carry guides. The idea is the probation officer is doing much more hands-on work with the youth, and it's not about contacts, and it's not about supervision. I mean, supervision is part of it, but it's not just a check-in, a compliance check-in. It's working with them on their criminogenic needs. And And there's a lot that probation officers can do in that regard, just from reinforcing certain behaviors or having them doing journaling or whatever. Or having them experiment with new behaviors. There's just a lot that probation officers can do. So yeah, I think Humboldt County is a great model.
Yeah, and I think you're totally right that we're really moving away altogether in juvenile justice from that checklist of did you make your curfew, did you go to school, did you do these things. And I would think that for the folks that are doing the work, that this is much more interesting than checking boxes. This is, I think, probably feels a little more.
I think one of the most frequent feedback I get from the probation officers is like they talk so much more, like they're willing just to share so much more than if you're just bringing them in like, okay, are you going to test 30 today? Like, when's the last time you used? Okay, your mom called me. You didn't do your chores last night. And so the POs were just like, you know, after they started doing groups, they're just like, oh my gosh, they just talk about more important stuff with their POs too. And it wasn't an easy switch for the probation officers either. I mean, we went through a time here where we were doing all these changes. We implemented the YLS. We went to a new case management system. We started getting them cross-trained. There was a lot of changes, and it wasn't easy. And I'm like, yeah, but we're asking our kids to change their friends and what they do and who they hang out with and their daily schedule. And boy, now we're having a problem with that. Can you imagine how that 16-year-old feels? Like we have a developed brain, right? So I think it was just good growth for all of us here to know, to go through that. And the POs they're like, yeah, I'm doing a group this session, or I'm doing 2 groups this session, and I'm like, great, like they're really enjoying it too, and it helps. They don't have the violations with their kids as much, right? And yes, we still drug test. Yes, we still hold them accountable, but we focus on their risky behaviors that could lead them to reoffend, not just to be, a good kid who does their chores every time when parents tell them to do that. So it does make a difference.
I agree. And I think, again, that that's really where we should be going with our juvenile justice work. And that the judges really supporting that happening in probation, I think, is super key. And I know we have some really great judges on right now that do. So I really appreciate that. So we're right here at the end of our time, and I'm just going to ask for final thoughts. And so, Gina, why don't you go first with any final thought you want to leave the judges with?
Just that I really appreciated everybody's questions. And I think that, I think the legislation in Nevada was a wonderful catalyst to doing a lot of these reforms around different practices. And then I just want to really reinforce what Pauline said about behavior change of personnel and judicial officials, if that may be the case. It's not easy, and I think it's so important to remember that we're asking the kids to change all the time, and they're getting in trouble if they don't. And so I think it helps with a little empathy about how much we're asking them to do at times. So I think that Nevada has implemented a lot of wonderful practices. I've seen some great work in many of your counties, the ones that I had the opportunity to work with, and I think that you're all on just a great track. Pauline?
And Pauline, your final thought.
I enjoyed all the questions also, and I just want to say, like, as judges for with the juvenile probation departments, you are so pivotal in so many ways. Both of my judges supported these changes, but questioned me a lot, and I had to bring all the information to the table. But they did trust the whole process, and the judges' support and questions and all of those good things are critical for the juvenile probation departments to really be proactive and not reactive, and to really change culture and behaviors in their own agency. So I appreciate all judges. I think you guys do a tremendous job, and I was honored to present today.
I would like to thank our presenters. I thought this was a really great conversation, and I really appreciate your expertise that you brought today. I'd like to thank the audience. We had, I think, a really great conversation. And I'd like to remind you that tomorrow we're going to be talking about engaging families. And so it's, I think, the other side of this, of how we engage families and how we figure out what we actually want from families when they come to court with us. And so with that, I will tell you, have a great afternoon, and I will see you again tomorrow.